I'd want to take this time to welcome each and every one of you out there in cyberspace who have taken the time to join us this Sabbath afternoon on any of your digital platforms. You're on YouTube watching us, if you're on Facebook, if you're on Instagram, wherever you are, we take the time this evening to welcome you on behalf of the Men's Ministry of the Seventh-day Adventist Church, on behalf of the AYS department, and critically on behalf of the Health Ministries department, led by our own Dr. Derek Cornwall, who you will hear from in just a few minutes. But before further ado, before anything else, I'd like for you to join us as we pray to ask God's blessing on this service, on this program, on this discussion, the complete man, P-L-E-A-T and not P-L-E-T-E, which our co-host, moderator, Kwame Thomas Elder, will speak about later. So let's bow our heads as you join me in asking God's presence here. Eternal God, who art in heaven, we thank you so much for blessing us. We thank you for being our God. We thank you for sending your only Son to die on Calvary's cross so that we, your children, could come today boldly before your throne. God, as we discuss the matter of man, dear God, and our completeness, we know, as the Bible tells us, dear God, full completeness is in Jesus Christ, who have all power and authority over us. So we approach you in the name of Jesus Christ and ask you, God, that there will be a blessing from this program as usual, dear Heavenly Father. We ask you to be with each and every one of the doctors that are on this program tonight, who will be giving of themselves, their service, their advice free, dear God, to all of us who are out there in cyberspace who want to hear this word, who wants to understand the psychological, the mental, the physiological, the emotional, and even the spiritual side that will come out about the complete man, dear God. So be with us, be with the presenters, be with the co-hosts, dear Heavenly Father. Be with them all. Touch each and every one who will listen. Send this link far and wide, dear Heavenly Father, so that, as you said, the people perish because of lack of knowledge. Whereas the Health Ministries Department, the Men's Ministry, and the AY came together to decide that we, through Jesus Christ, will share the message, will go out so that folks don't have to perish. So we ask again your blessings, your forgiveness, and we bless your name in the mighty name of Jesus Christ, our Lord and Savior. Amen. Right now, as I mentioned, we have a panel of experts. I'm not the one who's going to introduce them. That will be Dr. Cornwall and Elder Kwame Thomas. But before that, we're going to go to one song that will be played now. And then after that, we will throw over to our co-host and the panel of medical experts. A song.
I would love to tell you what I think of Jesus, since I found in him a friend so strong and true. I would tell you how he changed my life completely. He did something that no other friend could do. No one ever cared for me like Jesus. There's no other friend so kind as he. No one else could take the sin and darkness from me. Oh, how much he cared for me. All my life was full of sin when Jesus found me. All my heart was full of misery And whoa, Jesus placed his strong and loving arms about me, and he led me in the way I ought to go. No one ever cared for me like Jesus. There's no other friend so kind as he. No one else could take the sin and darkness from me. Oh, how much he cared for me. No one ever cared for me like Jesus. There's no other friend so kind as he. No one else could take the sin and darkness from me. Oh, how much he cared for me. No one else could take the sin and darkness from me. Oh, how much he cared for me. For me.
Thank you so much, Sister Sterd. No one cares so much like Jesus. He cares so much for me. I just want to leave one Bible verse with you. Colossians 2, verse 10, the Amplified Version says, and in him you have been made complete, which is P-L-E-T-E, achieving spiritual stature through Christ. And he is the head over all rule and authority. At this very time, as we discuss the complete man, who better to lead this panel of discussion than our own Dr. Derek Cornwall. But before, I will throw to our elder Kwame Thomas. Elder Thomas will introduce Dr. Cornwall, tell us about the word complete, how it is spelled, the meaning behind it. And while he does that, I'm encouraging each and every one of you, share the link. This is free, top-class medical expert advice that you could ever get. You would be paying thousands of dollars to be getting these, and our medical experts are doing that. Share the link, ask your questions on the social media platform. Our experts will answer. Over to you now, Elder Thomas.
All right, thank you very much, Brother Ransford. Hi, everyone. Just want to take this opportunity to say thank you for having decided to be a part of this panel, and the discussion is supposed to come. Now, I remember the first time with last week's program, rather, when we said the complete man. Someone sent a message on YouTube and said, Elder, complete was spelled incorrectly. And I had to counter by saying, no, it's a word. It's just a word that has hardly ever been used. But for those who are not as young as I am, you might be exposed to a book they call the Compleat Tween. That's how the word complete was spelled there. But when I looked at the meaning, the definition of complete, according to the Merriam-Webster's dictionary, is to have all the necessary skills and aptitude for completing or for doing a particular tasks or all tasks. So complete in this sense means the quintessential man, the classic man, someone who is well endowed to do whatever is necessary. So when we look at complete in this context, then we are looking at the man in all his facets. What is it that makes this man wholesome? What is it that makes this man complete? And as such, it makes sense for us to be looking at the man from a sociological point of view. We did that last week. And now we're going to look at him from a psychological, a physiological, and other points of view. So that's the idea behind the word complete. And that's why we wanted to use it this way. So before I even go any further, let me take this opportunity to say welcome We want you to share your link. We want you to ask your questions, post your queries, your comments, and your concerns, because this is being streamed live, and we would love to hear from you. Now, today's discussion will be facilitated by fellow director, Sister Cornwall, also a medical doctor. She will lead a team of panelists she will tell you about them, but I have no doubt that collectively we have more than what, Sister Daria, more than 100 years of experience in the health field. So there's nothing more that I can say besides over to you, and thank you guys for having taken the time to be a part of this discussion.
Thank you, Kwame. It's really a pleasure to be here, and I welcome all of you looking in cyberspace. Now, today we have an expert panel. As Kwame said, more than 100 years of collective experience here. And I just introduced the panelists to you now. We have Dr. Richard Mayhew, who is a consultant urologist and a lecturer at University of the West Indies and University Hospital, and also practiced privately at Kingston Urology. And he will share, of course, urologist. And a urologist is one who deals with all them big men's issue, prostate, erectile dysfunction, all those things to do with men. We're going to deal with that today. We also have Dr. Kevin Goldburn, who is a consultant psychiatrist and also a drug abuse specialist. And he also practices out of Apex in psychiatry. We have as well Dr. Leslie Gabe, who is a senior lecturer at University of the West Indies and University Hospital, and he is a pediatrician who is an endocrinologist. An endocrinologist deals with hormone issues, diabetes, different things with hormones with children, and he has over 40 years of experience in the medical field, and he also practices out of Hillcrest Avenue, right there, corner Hillcrest and Hope Road. And we have Dr. Robert French Sr., who is also has over 40 years of medical experience. We add it up, we're busting to 100, you see? And he is a consultant family physician who practices out of Highgate and also Old Harbor, and he's also practices the laws of health and talks about the laws of health. So we have an expert panel, and I will now ask Dr. French to give a few opening remarks, followed by Dr. Goldburn, and then we will head into the panel discussion.
Just unmute, Dr. French, just unmute.
Good afternoon, everyone, to Dr. Cornwall, the panelists, the moderator, and everyone in Media Land. I would just like to give a little preamble so that we can look at what we are really talking about. Indeed, at this time, we are in the branch of medicine called social and family medicine, looking at men's health. And I'd like to pose the question, who is a man? Is it just a male Homo sapien, age 18 years or over, with 23 pairs of chromosomes, including a Y chromosome? Or why is this age 18 considered to be an adult man? The age 18 was designated as the age you could obtain a marriage license or you could vote. That said, 50 years ago, the insurance companies for motor vehicles charged a higher premium if the male was under 21 years old. About 30 years ago, that age was put to 30 as the age at which the risk would be considered reasonable and a lesser premium charge. Now in 2021, that age is at 35 and approaching 40. Something is happening. The male cannot be trusted to safely drive a motor vehicle under the age of 35 years, hence the higher premium charged. The male under 35 in Jamaica is not considered by the actuaries who determine insurance costs as a fully sentient being until 35 years old. Indeed, then, half of his expected life of 35 years would have passed before he's considered a real sentient being. And by the way, the definition of sentient is, according to Webster's, the response to or consciousness of self, sense of impressions. So you'll have a sentient being aware and finely sensitive in perception or feeling. It should be therefore noted that only when the Jamaican man is about to become a grandfather that his risk profile starts to become reasonable to the insurance company. Assuming he got married at 18, fathered a child at 19, and that child does the same. And you know that such a person can legally father a child at age 16, so the problem becomes obvious. That only as a grandfather is the Jamaican male considered to be fully sentient. Why is this happening? Could it be that responsibility is not fostered? If someone is not taught to work before age 18, why should he, during his growth years, why should he be expected reasonably to work and be responsible just at 18? And another question I'd like to ask, what about the effects of marijuana? A high school smoker of ganja, marijuana, once said to me at about age 18 in a public forum that ganja makes you feel like the best. Now, if you feel like the best without having achieved anything much, why then should you exert yourself to achieve? Another boy at the same forum said, ganja gives good lyrics and an airy meditation. When a non-sentient or partially sentient being is now the father, and indeed even the grandfather, we have a problem. So, whereas I am prepared to discuss health issues, stroke, heart attack, prostate problems, I believe it would suit us well to recognize that we do have a problem with our males or the man. But I hasten to say, all is not lost. Just as after slavery, the church started schools in a population where everyone was illiterate. Now we have a population in crisis, and the church has the capacity to put social workers in the schools, to put social workers at the police station, at the bus stop, and at the taxi stands, and a change can be made. I therefore ask you to ponder these as we stimulate our discussion. Thank you so much.
Over to Dr. Goldburn. Unmute your mic and then you may speak. Okay, while we are waiting for Dr. Goldburn to come in, I just want to just start by positing a couple questions and then we'll take Dr. Goldburn's comments. What really is the difference? Is there a difference? And I'm going to pose this question to Dr. Gabby. Is there a difference between a teenage boy and a teenage girl? We tend to give different chores to males and females. Is there a difference between teenage boys and teenage girls in terms of their roles and responsibilities? Should they be not allowed to wash dishes? Is there a difference?
First of all, Dr. Cornwell, let me thank you for inviting me and allowing me to be a part of this discussion this evening, which I think is extremely important because I think we have, over the years, and rightly so, looked at female issues and bringing the woman into equity because she was not in equity. But I think during that process, we have actually forgotten the males, and we now have our girls and our women completely outpacing our males. I'll mention when Dr. French and I were in medical school, the classes were split pretty evenly between males and females. Our medical school now, one can barely find a male in any class you teach. But to answer your question specifically, yes. We know males and females are different biological beings, but they also are different psychological beings, and they're also cultured differently. And so the needs at various stages will be different. And then you look at what does the culture, how does the culture view a male separately from a female? And the culturalization of whether in fact one has males washing dishes or not washing dishes. Way back in the day, I certainly had to wash my fair share of dishes. But I think one really has to look at the culture. And however, males and females are in fact different, and one has to apply different methods when actually dealing with both sexes.
Okay, thank you. I just want to ask Dr. Goldburn, is Dr. Goldburn,
Yes.
Tell me something. How a parent asks, how can I tell if my teenage boy, what are some clues to know if my teenage boy or teenager is smoking ganja?
Okay. Yes, I too would like to thank you, Dr. Corner, for inviting me to be a part of this panel of experts. And I'm sure I'll learn as we discuss, as we go along. But as it relates to your question, there are different clues that you might pick up. One first clue that you might pick up is a change in their or attire, their interest in how they look, in terms of their grooming and their clothing. Then you might notice a change in their appetite. As you say in Jamaica, person look at if you want to eat a cow, meaning eating a lot. So eating frequently, so eating a lot because going to open the appetite, so they eat a lot. The next thing that may happen to the person may become a bit more irritable. And then somewhere along the line, you'll find that the teachers may put grades are falling, not doing well at school. So you might find the child not doing well at school anymore, and academically not performing as well as he performed before. And so before they might have mood changes, and depending on where they get their source of ganja, then they might involve in also stealing, because they might have to take money from mommy and from daddy in order to purchase the ganja, depending on where they're purchasing ganja from. So there may be different changes you may see, both behaviorally, the way they dress, and also academically. And those are the kind of major things you may notice in them, and may clue you in that they may be using ganja.
Okay, thank you.
Of course, red eyes.
You had some comments to make at the beginning before you were not able to log in. Tell me some of those comments.
Okay, so some comments I have, one is to do with men in general, but more so in a Jamaican context. I'm not sure about other contexts around the world, but in Jamaican context, men have poor health-seeking behavior. So men may boast that he never been to the doctor at all. So the poor health-seeking behavior. Two is that society expects that a man should not cry. So even if he's hurting emotionally or otherwise, he should not cry. A man crying is seen as being less of a man. So he should not express his emotions. And then on top of all of that now, there's some statistical findings we have found happening where depression, for example, is found to be more prominently seen in females. So we have more, when we do surveys and so on, we have more ladies coming for treatment for depression. Yet on the other hand, you find that more males abuse substances, ganja, cigarette, alcohol, cocaine, you name it. There are more males abusing substances. So one, we don't know if because men are using this in order to cope with their stress, whereas ladies are expressing themselves much more. And then a more startling finding is that we find that for example, in Jamaica, you have more men who have committed suicide. So in a year, we may have 61 suicidal deaths in Jamaica, may have up to about 52 of them being males and a few being female. And usually we know that depression is one of the precipitating factors for suicide. So it's not men are not facing issues or having problems, but it's like either they have wrong avenue for expressing it, which may be drug abuse and of some sort. And when they can't manage anymore, then they might actually kill themselves. Whereas the female are more likely, maybe because of societal orientation, are more likely to seek help. And you might find that there are more depression there, and you find that more attempts might be made by a female too, but less lethal attempts. But more fatal attempts are made by male in our context in Jamaica.
Those are serious points. I want to ask Dr. Mayhew, Dr. Goldburn said that we are having different healthcare seeking behavior in men compared to women. Dr. Mayhew, your practice, you're a urologist, so you have a large amount of men in your practice. What differences, what has your experience been in the health seeking behavior of men, and what would be some of your recommendations, or how can we fix this? I'm going to talk to fixing this from the man's perspective when the man is already a man. And I'm also going to ask Dr. Gabe, how can we have to fix this coming up from teenagers? Dr. Mayhew.
Thanks, Dr. Cornell, for having me on. Look forward to an interesting discussion. Specifically to health-seeking behavior, I couldn't say why it is so. I certainly agree that it is so. I suspect, certainly as far as the urologist is concerned, we suffer from the difficulty of the area we deal in. So men avoid us sometimes because they fear the possible outcomes of treatment for urological illness. I think sometimes they may also not want it to be seen that they have been to a urologist, because then, because of myths and other difficulties in our society, they don't want to be labeled with particular illnesses. So I think that is part of the difficulty as it pertains specifically. Overall, why they would not choose to look after their blood pressure or their diabetes, I suspect it's just part of the bravado. They think that I'm a big man, I don't have any problems, I'm strong, and would not want to demonstrate any sign of weakness in any regard. For some men, probably this smaller of the group, it is oftentimes just a time thing that they perceive they are unable to fit it into a busy schedule, or maybe a cost thing. But I think the other reasons probably dominate the difficulty in health seeking. How can we change it? I suspect it will be down to education, to forums like this, to discussions like this, to help people realize the importance of trying to diagnose any illness early, not just specifically to urology, but any illness is better managed when it is early. When the changes are not as advanced, it is easier to cure, it is easier to treat. And so hopefully we can just convince men that it is better to come in and have a conversation, check and make sure everything is okay, than wait until when they are feeling significant symptoms, trying to reverse the course of what has already taken place.
Thank you, Dr. Gabi. How can we fix this though going forward? Should teenage boys be having doctor visits? Or should they just wait until they're sick? How can we try to fix or change the health-seeking behavior of men from childhood, from teenage boys coming up?
Right, thanks, Dr. Conroy. I mean, I really think it's really so important having a pediatrician here, because a lot of what we try to do is stop the horse after he's already bolted through the gate. And what we don't do is in our children's early years is actually have them understand what the responsibility of taking care of yourself is about. And recognizing that, in fact, your body is your body, and you have to take care of it. And we take care of the outward part of our bodies quite readily. I'd hazard a guess that we all like to see ourselves well dressed and well coiffed and our hair in perfect order, etc. But we're not paying too much attention to what's beneath that surface. And some of the things I tell when I speak to children, and these are not necessarily adolescents, these are 8, 9, 10-year-olds, and especially those who I see with diabetes. I tell them that their body is theirs, that they need to take care of. And I say, if your dad had a car, and I see unfortunately a lot of kids with obesity, if your dad had a car and he puts bad gas in it, the car is going to mash up. If you, in fact, don't put the right things in your body, you don't take care of your body, then like anything else, any toy you had, anything you liked, it's going to break down. So I think as our kids come up, this issue about responsibility for the various areas in their life, which includes taking care of themselves, not just externally that you look okay when you leave home, but that you're eating the right things. You're getting your checkups, you're getting your vaccinations, and that in fact, you are looking after yourself. And if we can get this done through our adolescent period, where people realize and understand, and we talk about health education, and the ministry does health education, and we see the ads which are health education, but we're not looking at health literacy. How do we transfer that education into literacy so the individuals are actually practicing what they're being taught? And so yes, our adolescent males do need to see physicians on a regular basis. We in Jamaica, we only go, and Dr. Mayhew, I'm sure will tell you, only when we're sick. So only when there is a problem do we go and get it checked out. But certainly with health education through the years and understanding this adolescent period. And a lot of parents don't understand the adolescent period. We see the external aspects of adolescence, where our auntie will look at us and say, "Wow, you turned man now. You're a big man now." But we're not understanding all the other areas that go along with developing the young male. The areas which look at their academic aspects, their emotional aspects, things such as their body image, how do they see themselves, how do they relate to their peers, how do they relate in terms of sexuality, all these sorts of things are all part of that process that is happening in adolescence. And that's part of the internal stuff that's there. But we tend to see the physical thing, but not pay attention to the other things.
Thank you. Let me ask you, is it important, therefore, we spoke to health-seeking behaviors, and Dr. Mayhew spoke to the fact that men are not coming to, some men maybe don't come because they're busy or whatever to get their checks. Is it therefore, are you saying that teenage boys, is there any, okay, I know that children get immunization and they go to their doctors to get immunized and they are taken there by their parents. Now, when they reach teenage years, they may not be on an immunization profile anymore. Is it that teenage boys should be taken to doctors for checkups Is that necessary? Is there any recommendation like, okay, when your son reaches 15, should we ask him to check his body out? How does a boy check out his body? How does he become aware? Should he be checking his chest? Should he be feeling his testicles to check that there are no lumps? What should he be doing? What should we be doing to our boys, telling our boys?
Well, first of all, I think, first of all, that one should have checks each year. So our teenage boys should have a yearly check, because that yearly check will not just look at their growth, because most boys by the end of third form may have finished growing, but that check will also look at other areas such as have they completed their sexual development, what do they understand about that, their sexual development, allowing them to interface with a health professional so they can ask their questions and to be answered by a health professional and not by their friends at school who may have heard certain myths, etc. So I think these are important. I think when you look at the adolescent phases, there's early, mid, and late adolescence. And these phases actually precede adulthood. And just like in an infant, that you've got to be able to crawl before you can walk and walk before you can run, you need to achieve some of these milestones in early adolescence, mid-adolescence, late adolescence. And it's also important that when you see your teenager sees his doctor, yes, they may be taken by the mother, but there may be a 5 or 10 minute where in fact the teenager can spend alone with the doctor to explore questions that they may in fact be concerned about asking in front of the parent. So I think that's an extremely important aspect. And that way they're getting their information from a credible source. So yes, yearly checks should be done. And certainly we can pick up other chronic illnesses if the family has high cholesterol or early heart attacks in that family or hypertension. We can pick up these things early in our adolescent males if we are seeing them and not wait till they're 35 and have their first heart attack.
Thank you. So teenage boys should be having checks. Dr. Mayhew, what do you recommend? Some men, they don't go to doctor unless they feel sick. Is this fine if teenage boys should be going to the doctors to get their checks every year to get into a health-seeking behavior? What do you recommend for men, and at what age or so how should their health-seeking behavior be? Should they go to doctor for checkups, and when should that start? And what checks should they get?
I think we would encourage adult men to continue that same behavior and have annual reviews with a medical practitioner. What the man can do on his own is that we encourage all men to do self-examination. So just like women would examine their breasts, we ask that males examine their scrotum, examine their testicles. And so they can be early aware if there is any unusual change, any lumps with the testicles. Specific to the prostate, we advise, certainly in our jurisdiction, we advise them having assessments starting at age 40. If you were to review the literature from the United States, you'd see that they recommend starting at age 50. And that oftentimes causes some confusion. But we start at an earlier age because our population, being of African descent, we consider ourselves at higher risk of prostate disease. And so we recommend starting at 40. So it is, generally speaking, everybody should try to see a practitioner once a year, specific to urology, self-examine the testicles, and then start assessing for the prostate at age 40.
So at what age should boys or men, should just men start checking their testicles, or should boys start check? At what age you encourage that they start feeling the testicles to see that there are no lumps or bumps?
Well, I would ask Dr. Gabe to confirm, but testicular tumors are actually more common in the adolescent age group. So I would expect that certainly as a child, it would be a parent examining. And then as soon as they are aware enough to just suggest to the young men to start examining their testicles. Dr. Gabe?
Yes, certainly Dr. Mayhew's correct. The testicular cancers tend to predominate between, say, 15 and 30 years of age. And so certainly once the male has completed their development, and the development, and I teach this, is not necessarily an age, but a stage. And so we go through various stages in that development. But once they've got full adult development, then it should now become part of their general routines of checking their testes. So that may be anywhere from the age of 15 to 18.
There is something that goes part and parcel with this, and it's actually hygiene as well. Along the same lines, along the same time that we're encouraging them to self-examine, we're asking them to have proper hygiene. We are not a culture with a high incidence of the practice of circumcision. And so we have to reinforce the idea of cleaning the penis properly and let it be known that failure of proper hygiene, certainly with regards to cleaning the penis, can lead to certain problems with health. Apart from just, let's say, it being unpleasant if you have an unwashed male, it also can lead specifically to various problems with health if proper hygiene isn't practiced. So I would want to say, along with the examination, we need to encourage proper hygiene, especially of the.
Thank you. Dr. French, we speak to the health-seeking behavior of men, and they don't like to go to doctor, they don't like to take their medication. But one of the things that men may say is that when they take medication, they end up with problems such as erectile dysfunction, where they fail to have an erection. I'm going to come back to the thing about erectile dysfunction to Dr. Mayhew about causes of it. But how do we address now people taking high blood pressure medication, diabetes medication, and they're saying that it's causing them to have problems with their erection, so they are not taking it? What are your thoughts about this, and how do we address this?
Thank you so much, Dr. Connell. This was true years ago in terms of high blood pressure medication. I can think of one like methyldopa that would definitely cause erectile problems. Now, these medications are hardly used in men nowadays, but these thoughts and traditions are passed down in the various male areas, like at the taxi stands, at the police station. So you'll find that where you have these large groups of men, they perpetuate these myths. It is the doctor's duty, and when they do come to the doctor, because many of them do have high blood pressure, we point out to them that the newer medications do not cause this, and that once they take their medication, they'll be more seeking to protect their libido and their virility rather than destroying it, because after all, stroke and heart attacks and general destruction of the cardiovascular system causes more erectile dysfunction than medication. So certainly the newer medications that for high blood pressure do not cause these erectile problems, but we have the job of persuading our men when they do come to let them know that taking your medication for high blood pressure will not damage your libido.
Thank you. Dr. Mayhew, So we're talking about inability to have an erection, erectile dysfunction. One patient said to me that when he went to his doctor and to tell the doctor that he was not having a good erection, the doctor told him that he did a lot of things with him. And one of it is that he is maybe at risk for stroke and heart attack. And he was confused. What does an erectile dysfunction or the inability to have an erection have to do with any stroke or heart attack or any risk? Is there any link? What are the causes of having inability to have an erection? What are the causes of erectile dysfunction? Or what is erectile dysfunction?
Well, erectile dysfunction is the inability to have an erection to have satisfactory sexual intercourse. So it is not just absolute failure to get the erection, but it is if you're unable to get erection, which is either firm enough or sustained for long enough to allow for satisfactory intercourse. And as Dr. French says, there is an association between having strokes and having heart attacks and erectile dysfunction because they are all served or caused, the pathology behind it lies with vascular problems. It was not appreciated fully, perhaps maybe up until about 20, 25 years ago, the extent to which vascular changes contribute to erectile dysfunction. And it is now recognized that, in fact, perhaps the majority of erectile dysfunction is related to this. Now, there are times when erectile dysfunction will be caused by nerve problems, and sometimes when it may be caused by anxiety and other different things. But by far and away, most of the times it will be due to some vascular problem. And the difficulty is because the erection is essentially a vascular phenomenon. You have to have good flow into the penis, and then the blood is held in the penis until the coitus is completed, and then the blood empties. So all the things that affect the ability to have good flow into the penis will affect your erectile function. Now, it has been demonstrated that about 30%, so let's say a third of the persons who present to an emergency department complaining of problems with the heart, so having a heart attack or chest pain due to heart, will, given their history, pre-existing erectile dysfunction. Similarly, you'll find a significant number of men who have strokes having pre-existing erectile dysfunction. And it is often described that the erectile dysfunction is a warning sign for the underlying vascular problem. The arteries which supply the penis are relatively small. So when the process starts in these arteries, oftentimes the symptom will present earlier than organs served by somewhat larger arteries. And so you end up with the erectile dysfunction showing up a little bit earlier. The underlying process generally is hardening of the arteries, so-called the medical term atherosclerosis. And the predisposing factors are generally smoking, hypertension, high cholesterol, and diabetes. So as mentioned before, if the men look to maintain their general health, control their blood pressure, practice good social habits, control their diabetes, they actually would be helping to protect themselves from erectile dysfunction. And so they shouldn't have to worry about the medications to keep those things properly managed.
All right, thank you very much, Dr. Mayhew. But I'm seeing some comments or some questions rather on YouTube. I see Shalveen McKay was asking, what are the signs and symptoms for testicular tumors that we should be aware of? And that's directly for, well, that's most likely for Dr. Gabe. But then prior to that, someone asked the question about the changes that they can see, if whether or not Dr. Goldberg could elaborate on the dressing for persons who started smoking. So I'll just look at the question first about testicular tumors, and then we go back to the last question, the first question.
Right. In terms of testicular tumors, what one may feel is a new little lump on the testes. However, you need to be feeling it so you can recognize that there is something there that's new. Or the testes may become, you may feel a discomfort or swelling in the testicle. There may be some discomfort in the groin as well. Not all the time, the Dr. Mayhew can confirm this, not all the time do you actually feel a lump, but there may be some certainly discomfort or swelling in the testes. But having said that, one needs to have our checkups and have our physicians doing these examinations because boys, in fact, playing football, etc., may get a hit in the testis, that sort of thing. But any pain in the testicle needs to be seen by a doctor. But the other thing that may happen is the testicle may, in fact, twist on itself, which can damage it. And I'll refer it over to Dr. Mayhew if there's anything else he wanted to add.
No, I think that's essentially the important point. It's just for somebody to notice a difference that wasn't there before. And they will know that there's a difference because they have been examined themselves. And then outside of that, pain, discomfort, anything that you just say this feels a little different, and have somebody look at it.
So, Dr. Mayhew, in my own experience, I have heard about the idea of testicular cysts growing on the testicles. How dangerous is that, and at what age should we begin to look at that? Because I'm not necessarily a teenager, but I know that I've heard of it. I've heard of it from persons older and younger than myself. So we have gotten the idea of testicular tumors out the way, but as it relates to cysts now and those other kinds of maladies, how do we even know what to look for?
Cyst is going to feel similarly just like a lump on the testis. So the patient, the layperson, is unlikely to be able to distinguish between a cyst and a testicular tumor. That distinction would be made by the doctor, oftentimes with the help of an ultrasound. The breastfeeding is not something to worry about. It is not a cancer. It is not going to cause harm. It can be a cosmetic problem if it gets very big, and it can be, again, uncomfortable if it is big. But a cyst is simply, if you want to consider it, a bag of water. Not really water, more fluid similar to what you find in semen, but it is not harmful at all and would not be of significant concern. The challenge is just to make sure that the true nature of the swelling. And so if the doctor finds that it is just a cyst, then oftentimes no intervention would be required.
I could interject. I remember Dr. Gabe saying that teenage boys should be going to their doctors once a year. And I think this is one of the reasons why he said that, because the doctor, having clinically examined them, can pick up any changes. There's wisdom in what he said. Teenage boys, so mommies, daddies, we should take our teenage boy teams to have their checkup every year. Even if they are not getting immunization, we should still take them once a year and give them good health practice to health seeking behavior. And also they will pick up any tumors if they are there at that time. Let me hand back over to our other moderator who had questions for Dr. Goldburn.
Yes, Dr. Goldburn, we saw where someone asked the question, asked pretty much to elaborate on the idea of dressing for persons who have started smoking. And then after that, no, just go with that question. I'll look at the other questions thereafter. So while we wait for Dr. Goldburn, Dr. Gabe, there was a question that was being posed. At what age, ideally, should a child stop going to the pediatrician and start going to the general practitioner?
And I don't know if that's an economic question, right? Dr. French too. But in our system, our public hospitals stop seeing children at the age of 12. So Bustamante, and whether you're in Spanish Town, whether you're at Maypen, they stop seeing children at the age of 12. At university, we in fact will admit children up to the age of 16, so they can be admitted to the age of 16. And we will, in fact, in our clinics, certainly in the pediatric endocrine clinic, we'll keep children up to about the age of 20. In my personal practice, what I normally do is once a youngster is no longer in the educational system, whether that be after 5th form and he's now in the workforce, or after university and he's in the workforce, they then transition. But as you can see, there are different things across the country. And I think the bottom line is that whoever you're seeing, whether it's a general practitioner or you're seeing a pediatrician, you must have established that good relationship where, in fact, you can ask questions with the physician, and you broach any other questions that you want to talk about. I mean, if you have a 15-year-old who's seeing your general practitioner and you're concerned about their genitals, have them examine your child. But it's really also about us as patients also being responsible. Yes, there used to be a God complex with doctors. That's no longer there. So, and most patients now have Google and they come to you with all the questions. And I think that's good. That's important that we, in fact, not necessarily challenge, but seek information from our practitioners. And if you're uncomfortable with one practitioner, then you go to another practitioner. You have that right. But I think it's important that we, when we go to our doctors, write down the questions we have. And a lot of these questions are related to fears that we do have. Is my child going to become a diabetic like his grandmother? Ask these questions and have our physicians, have your doctor, have those discussions with you.
Thank you. So coming back to Dr. Gabe, still on you. We've gotten questions from parents about sometimes young boys having a heavy chest. Is it abnormal to see teenage boys with a little extra breast more than what you would think is a flat chest? What is that? Is it cancer?
All right, good question. And I can jump at that last word right away. It's not cancer, okay? Having said that, yes, men can get breast cancer. So, but it is extremely rare and almost unheard of in young adolescents. And so what really happens with boys getting a little bit of breast tissue is that, in fact, as their testes start to produce testosterone, which is a male hormone, the testes is like a little factory that is producing testosterone. And it goes from a pea to the size of, say, a chicken egg. And as that process happens, the testes makes more and more testosterone. Now, at the beginning of the process, some of that testosterone gets converted, especially in fat, to female hormone. And if the balance between the male and the female, a little bit more female compared to male in the early parts, these boys may get a little bit of breast tissue, and it usually comes to attention by the fact that they have a little gunga peas or red peas behind the nipple, which is tender. And their parents touch it, and it's quite tender to touch. And parents then start worrying, oh, is this cancer? It's not cancer, and in most situations, they go away. The concern happens, though, when we have boys who enter puberty obese, so that they have a lot of fat, and that fat converts lots of testosterone to estrogen. And these boys can have what we call gynecomastia, and this is where they get significant breasts, okay? And we're seeing more and more of this because of the obesity epidemic, which is across the world and which is also here in Jamaica. And once the breasts become pendular, meaning that they fall, then the only way to correct them is by doing plastic surgery. So we really try and have our teenagers be recognized, and this is where these yearly visits happen and are good, where you're recognizing that they're overweight, they're obese, they're at risk for significant gynecomastia, and we start dealing with the weight with appropriate eating habits and exercise so that we can prevent it. If the breast doesn't fall, then a lot of times it will go away with weight loss. Once the breast falls, it's a surgical procedure. Now I segue from that to say that breasts in boys are a significant psychological impact. And as they're going through their early adolescence, where body image is very important, and they struggle with the various aspects of their body image, having breasts create even more stresses in that young adolescent's life.
I thank you. Kwame?
Oh, well, it's just back to Dr. Goldberg now so that he can answer the question so that we can get back to all these questions that are being posed to the others.
Okay.
Can you repeat the question?
So the question was about the dressing, about the changes that we should look for in someone who has started smoking.
Okay. So youngsters who start smoking ganja will find they have a decreased interest in a lot of things, including their hygiene and their appearance. So you might find that they don't tuck the shirt in the pants as usual. They don't take as much attention, how they put themselves together and how their clothes are. So you might find that they have less concern about how they appear in terms of both hygiene, in terms of making sure they smell nice, have a good bath, and also the way they put their clothes together. So you may see a change in that as one of the signs of a person using ganja, a youngster using ganja.
Okay, thank you very much. Now, another question that was posed was at what age, within what age group do men mostly experience erectile dysfunction? Or in other words, when does it start? Is there a numerical age that we can say, all right, this is where we can expect to have erectile dysfunctions?
I wouldn't say that there's an age at which erectile dysfunction starts. You can have erectile dysfunction at any age in a sexually active male. What will change over time is the cause of the erectile dysfunction. So if we find erectile problems at the onset of sexual activity, so in the young male, then we'll be more concerned about the possibility of something congenital. In somebody who was previously properly functional, had no insult, and by insult I mean no injury, no illness, and then start noticing erectile dysfunction, then it might be something more related to social or psychological factors. And then as you get older, you then have the possibility of the vascular issues, and then a return to the possible neurological or nerve-related causes. So it is not that there is any age at which you can't have erectile dysfunction. It is just that what is the potential cause will vary depending on the age of the man.
So before you go, someone posted a question that they thought that erection had to do with muscles. Please address.
No, it's it really doesn't have much to do with muscular function. It really is a vascular phenomenon. The penis has two main cylinders in it, and the cylinders, if you were to cut them across, would almost look like a sponge. And how you get an erection is that that sponge becomes filled with blood. So if you can imagine two cylinders looking almost like sausages, but inside of it is a spongy type of tissue. It gets very good blood supply coming straight in with an artery, and it fills it completely until it becomes very hard, just because of the tension of how well it is filled. And then the vessels or the veins which drain the sponge close, and so the blood is then trapped in the sponge until coitus is complete or sex is completed. Then those veins open up, the blood runs out, and then the penis goes soft. So it is all a vascular thing. It's not a muscle. So you can't work it to make it stronger. It is all dependent on blood flow into the penis.
So are you saying then, doctor, that people who get stroke and heart attack and diabetes and stuff, it is a blood problem where there's so someone is trying to understand how the link between the dysfunction and the stroke, what is it that there's a same cause? What is it?
Right. It is the same cause leading to the problems in the blood supply to the different areas. So if you have a problem with the blood supply to the penis, then you get erectile dysfunction. If you have a problem with the blood supply to the heart, you get a heart attack. You have a problem with the blood supply to the brain, you get a stroke. You have a problem in the blood supply to the legs, then you get what people call poor circulation. So it is all of the same underlying problem, being poor blood supply. And then that change, the hardening of the artery, the atherosclerosis, which contributes to this poor blood supply, is related to hypertension, it is related to diabetes, it's related to high cholesterol, it's related to smoking. So it is a bit of a vicious cycle, a bit of a tangled web, but at the base of it all is changes in blood vessels leading to the different situations.
Just to wrap up this erectile dysfunction or inability to have an erection issue, someone posted in the chat, what are the treatments for erectile dysfunction? Is there any cure for it? He also asked about hernia. At what stage should it be treated with surgery? Also, but first, let's ask, is there treatment for erectile dysfunction? Is there any cure or possibility of a cure?
So again, it will go back to what is the cause of the particular instance. So for some things, we can, yes, completely eliminate it and it will never come back. If it is a problem with the blood supply to the penis, we cannot restore the blood supply to what it used to be. But with medication, we can get sufficient improvement that it is essentially, for all intents and purposes, cured. In some patients, the progression of that vascular problem may make it difficult to achieve that situation. But for the majority of patients, it is, for all intents and purposes, cured, but you would have to be on medication to continue. but you would continue to have good function. So it basically depends on the cause. If you are having erectile dysfunction because of injury to the nerves which supply the penis, then unfortunately that is quite resistant to satisfactory treatment and certainly isn't curable. So it just depends on what is the underlying cause.
So a question that came up earlier.
I'd like
Sure.
to interject.
Sure.
Diabetes, for instance, and even high blood pressure, they cause damage to the blood vessels. But with proper lifestyle changes, we can now get significant improvement, as Dr. Mayu alluded to. But I'd just like to emphasize that proper control of your diabetes and high blood pressure with lifestyle changes, eliminating, for instance, dairy products and other animal products that increase cholesterol and increase damage to the blood vessels, will restore to a great deal, as Dr. Mayhew said. And also, most importantly, people who practice these proper lifestyle measures can enjoy good vascular health and hence good sexual performance well into their later years, the 90s even. So it behoves us as a population to practice good eating habits, good dietary reform, leaving out the fatty foods and the animal products where possible, and eating right in terms of vegetables, peas and beans, and getting your protein from your peas and beans and your vegetables and your minerals, protecting your endothelial cells, which is the lining of the blood vessels, will protect the population in terms of their erections, and also will reverse, because diabetes and high blood pressure, the mainstay of the treatment is lifestyle change. Medications do help, but medications are secondary to the lifestyle changes. Thank you.
So just to wrap up this section, a few questions that came up, because apparently this topic has been generating a lot of questions, perhaps more than we expected. But one of the questions that came was whether or not there was a connection between masturbation and erectile dysfunction. That's one. And two, if this could be hereditary, or is just psychological or social pressure that can cause erectile dysfunction. So those are the three questions upon which we'll wrap this section up.
Someone also asked if obesity can cause erectile dysfunction.
No, masturbation doesn't lead to erectile dysfunction. And I suspect the other question we probably answered, as in we went through what are the various causes of erectile dysfunction, and how it may be managed differently depending on cause.
So obesity does not cause it. And this isn't hereditary.
So, as I said, masturbation doesn't cause it, and it's not hereditary. We discussed the causes. When I did mention that if you find somebody having a difficulty with their erection at the very onset of trying to have intercourse, it could be something congenital. And by congenital, I don't mean hereditary. By congenital, I mean that there's something happened with their organ while it was being developed in the womb or subsequently as they grew, and it resulted in a problem with the penis being able to get erect. Now, to be clear, that is very, very, very unusual. The penis is quite robust and resistant to most problems, so that is really a very uncommon thing to happen. But on occasion it does, but it is really quite uncommon.
Obesity, I might add, can cause erectile dysfunction because obesity can lead to diabetes. It's often associated with fatty liver disease. And as Dr. Gabby had said before, the obese person will end up with a higher estrogen level, which also will reduce the testosterone effect, the effect of testosterone on the system. So obesity can lead to hypertension, which damages the blood vessels. Obesity leads to type 2 diabetes, which damages the blood vessels, and obesity is often associated with fatty liver disease, which interferes with the actions of the liver in terms of metabolizing hormones. And in fact, the fatty liver disease can become so severe that you have what is called steatohepatitis, even in people who are not alcoholics. And indeed, though, liver disease in the alcoholic leads to severe hormonal changes, and which also influences sex, erection, and sexual activity. Indeed, many alcoholics spend their time at the bars looking on the pictures because they dare not go home because they cannot function at home. Thank you.
So Dr. Mayhew, a question, I think it's directly to you. Is it healthy? So then, is it healthy for men to masturbate? That was the question. So that's the last question that I'll ask on this. I swear, I won't ask anymore.
I mean, if by saying it is healthy, you mean that you do better sexually if you masturbate, I don't know that to be the case. So I can't promote it as being something that is healthy. I mean, masturbation is a habit, and like a lot of things, sometimes a habit, too much of something can be a bad thing. But I can't suggest that it will promote your sexual prowess or anything in that regard. And it certainly won't help you to have better erectile function.
Okay, thank you very much. So Sister Daria, where?
Okay. What is toxic masculinity? What is toxic masculinity? I leave the floor open for this question. What is toxic masculinity?
Since we are all contemplating, I would like to say that my impression of what would be called toxic masculinity is that type of behavior which results in a more pronounced effect of maleness than would be acceptable. In other words, males have bigger muscular build. Males tend to be more aggressive by virtue of their testosterone. Now, for something to be toxic means that it is harmful. And indeed, we know that there are some people who behave in such crude ways as to be harmful to themselves and to others, both physically and psychologically. Now, there are the psychiatrists will come in and explain more, but there are men who try to show that they are males physically because emotionally they might be having a challenge. And so they overcompensate and with aggression and with crudeness and impoliteness, because they underlying that they are trying to cover the fact that they might well be feeling and acting different.
Yes, and I'll agree with that, Dr. French, that to believe that being a male and being fully male means that you must be aggressive, you must not show emotions, will definitely not be good for you in terms of your own emotional health, because if you're going through issues and able to show emotions, then person won't be able to help you. But also in you setting a role model for the youngsters coming up, they need to see that men have feelings, men can feel hurt, and even towards youngsters, if you have a youngster, especially a male in your company, as a man, you need to be able to show them a balanced view of a person, that yes, you want to be strong, yes, you want to be able to overcome challenges, but you need to show that you also can have feelings when things are going wrong. You can feel hurt, you can feel emotional, so that they can have a balanced view that to have emotions, to feel sad, to feel anxious, feel distressed is a normal response to situation, but how you manage it after is important. So it's important to make sure that we don't display maleness and masculinity as all aggressiveness and muscularity and being strong, but also where there's a balance to it. And we need to make sure of that balance being exhibited in ourselves so we can get help, and also we can set the right role model for youngsters coming up to know that maleness means that you should be balanced in your approach to life and in your expression.
Thank you. Let me ask another question. How do we encourage boys, or how do we deal with dealing with peer pressure? What tips do we have to helping our young teenagers deal with peer pressure?
Well, peer pressure is something that they'll always face because they get older. You find that they look more to their peers, to what is the norm among their peers. But what's important then is for the male figures especially, and even the female figures in the child's life, to make sure there's an open communication, that the child can be able to know that you the parent, you the guardian, is concerned about every aspect of his life, and he can come to you and ask you almost anything. Because if you do not show that openness and a willingness to allow different topics to be discussed with you, then they'll find other avenues, and that's where peer pressure becomes the overriding factor. But if they're able to see you as being someone who's able to identify what they're going through and be willing to discuss it with you, then they'll find out even when they have peer pressure saying to them, do this and do that, they'll come and check you as an adult in their life to see if it's okay, and then you can have an influence of them to work it out and make the right choices. It's important to have open communication, non-judgmental communication, so the child can feel welcome to speak to you about almost any matter, with sexual, whether it's with drug abuse and other things. They'll be willing to approach you, so they can be always openness and this ability to have this sounding board within the adult and not just take what peers say as being gospel.
Any other tips? It is.
Well, I was going to add. No, I'm just going to add that I think, and if we come back down again to the child, one of the important things for parents to do is to, Dr. Goldberg said, is communication at all levels, and the ability for parents to communicate a value system that in fact they would like their child to understand and to be able to feel supported by that value system. And trying to establish a value system doesn't start when you've got a teenager. Your value systems start in preschool, going through the various grades. And the value systems that the parents give their child are really what are going to form the foundations by which this child, as an adolescent, will have a choice of falling back on. Mm-hmm. If an adolescent has had no value systems, no support measures, they don't know where to go, then they are going to feel supported by their peers. And if they're lucky, they've got peer support, which are positive peer groups, or they may fall into negative peer groups. And that's why in high school, some of the organizations, Cadet Corps, Boy Scouts, etc., these organizations, which also help to try and reinforce those value systems, are positive things that should happen. Right now, and this is my pet peeve, a lot of the educational system is really about bookwork, and we're not getting enough of those other social organizations, along with sports, to actually help in the development of our young people. And as our children grow up through primary school, through the grades, they need to learn to understand things such as empathy, loss, responsibility, and all these things can't be given to them unless parents talk to one another and create a framework that will allow this child to grow and in fact develop and have what we call resilience, which is the ability for that child to go through the teenage years, buffering all the challenges that come in the teenage years, and successfully navigate those teenage years. So I think all of this has to start from the early days. I think somebody asked, is it ever too soon to talk to your child? No, it isn't. And but you talk to your child based on the level they are at. And talking to your child doesn't mean you're telling your child stuff. You're actually listening to your child and understanding what they want to hear from you, what questions they want answered, and appropriately answering them. And I think that's important. So any farmer knows that the sapling, the early plant needs to be nurtured, cultured, and fertilized so that you get a wonderful product at the end of the day. We can't leave our children scattered on the barren earth and think that at the end of the day, we're going to get a fruitful and bountiful supply from them. So I think we really do have to look at that early childhood phase and how we develop these value systems. Thanks.
I'd like to make a comment. In Jamaica, our situation is that we have so many single parent families, large percentage of single parent families, single parent being most times the mother, who has to work also to provide for the family. And so they cannot physically and mentally and emotionally do all the aspects of the parenting that they might even want to do. So mentorship by concerned and well-meaning people through past students associations, people who have achieved and who have benefited from the system, I find can go a far way. In fact, I've been involved in some of this myself. Going back to your school and sharing with the guidance counselor with his children, various aspects of life so that they can develop a framework in which to see themselves and to live. Because a framework will develop, and as we have been saying, usually by virtue of peers, but the person needs an individual framework on which to balance the peer behavior. So that is where church and school comes in. School also, as you, Dr. Gabriel said, has been skewed to book learning. However, there are principals who recognize that they need this enhancement. And so when proper resources can be found, this is where people like ourselves come in and people from the church who are well-meaning, if given the opportunity, can do much in helping to build the kind of structure on which students can develop their lives. So the social work by churches, schools, past students association will go a far way. Because as I've had to say to some children in school, when a father does not care about the children or about a daughter or a son, it is not only the daughter or the son who is suffering. He is also suffering the loss of not having the benefit of seeing that son or daughter grow up and to become, to share in their joys and sorrows and the various nuances of life of a developing human being. So someone has to step in to fill the gap and to allow the children. So many times I've seen the child believes that the father is a cruel and terrible person because the father is not being a part of the life of their lives. Yet, indeed, what is happening is that the father did not get that structure himself. And so that area of his life is totally devoid of any frame of reference, and so he cannot do it either. So people who have benefited from that, such as this group here, can do a lot in terms of helping to build that framework, as I've had some experience in myself.
So this question was posed earlier for.
Can I just add?
Sure, you can.
And I agree wholeheartedly with Dr. French. As a society, we have not been a Eurocentric society where we have father and mother to an extent. But we used to have a matriarchal society where, in fact, and where a community would support the child. And I think this is where, in fact, we need to encourage and go back to, where communities, in fact, come back and support. Grandparents are no longer grandparents, they're 30 years old and 35 years old. But where the community, and certainly as Dr. French said, the organizations such as the church, schools, the various groups, Kiwanis, etc., need to in fact be supportive of our kids in the community. We tend to want to support our adolescents, but I'd really love us to go a step below and earlier and be supporting our grade 4s and our grade 5s, that group. So as they hit the high school, they have a better support base to move through. Thanks for allowing me to state that.
You're welcome. So, Dr. Goldberg, the question that was posed for you was, what are the roles of women, if any, and the psychology of men to be complete? And specifically was, are there any studies that shows the effects of female support on men's health?
Okay, very good question. And it's very important to have both male and female in the home raising children, because what the male learns from the father is different from what he learns from his mother. So from his mother, the mother helps him to learn to relate to the opposite sex. So it's important that the mother have a close relationship with the son in raising the son, and helping the son to have respect for the opposite sex, to know how to relate to them. Even small things like, for example, walking with your mother, making sure that you don't walk and leave your mother behind. As I did when I was younger, my mother told me that, no, you shouldn't do that, young man. You should walk alongside with me. You should walk before me. So even those little things that need to be told to the mother raising the child, in helping the young male coming up to learn how to relate to the opposite sex, in order for him to be a complete man. So he needs a father to know him how to behave as a man, and the mother to help him to know how to relate to the opposite sex. So both have a vital role in raising a balanced youngster.
So then are we to say that because we don't have, if a house that is raised by a mother,
yes,
can she get any tips as to how to help to mentor a young child, a teenage boy? What are the tips for mentoring a teenage boy and teaching him to deal with pressure and teaching boys to be resilient?
So one thing you could do is that, for example, if there are other male figures in the child's life, like an uncle or a grandfather, he can also assist. I must mention here that if he's raised by a mother alone, what can happen sometimes, you'll find that he may have a viewpoint, for example, growing up with a mother who's very domineering, for example, that as a man, and he goes become a man, he may feel that he has to pay the I won't say subservient, but the role in a relationship as being allowing the mother to take in charge, because he's used to it from as a child. So when he's in a relationship with his partner, he takes a situation where he listens to his mother without even having a discussion, because that's where he was raised. So it's important to really realize that a mother-only home situation can cause a young man to have an unbalanced view as to how he should relate to the opposite sex as well.
I would like to make a comment. Can I go on?
Yes, go ahead.
Sure, you can go ahead.
Yes. I am informed that in Japanese society, the culture is that the mother tries to rear the son to be the type of person that she would have liked to have as a husband. In other words, there is a cultural purpose. They do it so that I am creating the best husband I can make for the next generation. Now, we don't have to adopt that wholeheartedly, but we can look at it, and that's where intelligence and education comes in. We can look in other cultures, see what is done, and we can do it. And in fact, yes, we talk about the Japanese because we know of it. I mean, they're a first world nation. But even among certain African tribes, there are cultural things that are done to prepare a man. I'm not talking about mutilation or whipping or all of those things, but to prepare a man to be a good husband. And the mother can have a great influence on that. Sad to say, in our situation, I personally have seen and know of women who have taken the opposite view, in that they believe that they were hard done by the man, and they are creating men to go out and hurt some other women, and they literally do it in terms psychologically. Now, human beings can make change and make educated change, and therefore this forum and others like it can literally influence people to say, we don't just sit down and let things happen to us. As a mother in a single family, I can study and say show my sons how this is how your father is not here, but this is what we would have expected him to do. And when you grow up, this is what you do. You provide, you care, you listen, and so on. It can be done. And this is what this forum should be about. Thank you.
Thank you. I saw two questions coming in for Dr. Mayhew. One, are there other reasons for increased PSA or for elevated PSA? Is it only prostate cancer that causes the PSA to increase? That's one. Two, does a man have to have the finger test to check for prostate cancer, meaning the rectal examination? Is there any alternative to that to avoid the finger test? And three, it's a mouthful, it is said that the way a man sits, if they sit and compress the testes, the seeds, if they wear tight clothing, that could cause harm. Is there any truth to that sitting and squeezing the testes or wearing tight pants also can cause harm to the testes?
Okay, with regard to the PSA is a blood test for those who aren't familiar with it. It stands for prostate-specific antigen. It is a substance that is released from the prostate and gets into the bloodstream. And we can measure the levels of it in the blood and make interpretations with regard to the prostate. It is something that, as the name suggests, is specific to the prostate, but not specific to a particular condition of the prostate. So just the benign growth of the prostate, as all men get older, the thing we call BPH, that can cause the PSA to slowly rise. If your prostate is infected or inflamed, that can cause the PSA to go up. And if you have a prostate cancer, a malignancy in the prostate, that can also push up the PSA. So it is the role of the practitioner now, when faced with an elevated PSA, to decide which one of these scenarios is the likely cause, and then manage accordingly. So in short, it is not only prostate cancer that can cause it to go up. It can go up by other means or mechanisms. We don't assume you have cancer just because your PSA is up. And it usually takes some assessment and investigation to decide what exactly is causing the PSA to go up. Alternative to the rectal examination, unfortunately, there is no good alternative at the moment. Even the use of the blood test is not 100%. You can have normal PSAs within range with the presence of something in the prostate. The rectal examination allows us to feel the consistency of the prostate, and we can tell a number of things by feeling the prostate, not just how big it is, but are there areas of tenderness? Are there areas that feel hard and rocky, which are suggestive of cancer? So the examination is actually an essential part of the examination. It is like how you would examine the breast in a female and be able to pick up a breast lump, like how you'd examine a testicle and be able to feel a lump. It is the way we can access the prostate. The anatomy of the body is really why we have to do the rectal examination, because the rectum sits right in front of the prostate sits right in front of the rectum. And so with a finger in the rectum, we're feeling the prostate through the rectal wall. And it's the only place that it really presents itself that you could feel it. So there's no good substitute. Ultrasound does not replace it because the ultrasound can only pick up something in the prostate when it is pretty far advanced. Potentially, you could argue maybe you could use an MRI, but an MRI also isn't 100%, and it is not going to be accessible for the majority of the population in any regard. So there's no good substitute for the rectal examination. The question of tight clothes. The issue with wearing tight clothing really relates to infertility more than anything else. And it is the concept of the testicles need to be maintained at a certain temperature for them to make sperm the best. To be honest, it probably doesn't matter for most people. They would not notice anything significant from a sperm production point of view or anything else if they are wearing tight clothing. It is probably mainly only those who already have their testicular function compromised in some way, and it is equivocal, then that would affect them, as in the temperature of the testicle would affect those. So for the majority of persons, it probably doesn't matter significantly whether you wear tight clothing and so on and so forth.
Okay, thank you. The role of, as we wrap up, the role of the woman in the home, and the man. Someone asked a question. I observed that the laboring class of men and some women too rely on the use of drugs and alcohol to be able to work. Why is this so? And are we losing men to this habit? A quick answer before we wrap up.
I think before we go on though, we could answer that in the context of the question that was asked before, whether or not, while considering the complete man, what are the thoughts of men seeing a psychologist on a regular basis? Because as men, we tend to shy away from that, I think. So you can answer that question that Dr. Cornwall just asked in light of this last question.
Okay, so into my opening remarks about depression, and that depression is quite prevalent in Jamaica, but mainly still among women. But then substance use and even suicide is more common among men. So it is really speaking the fact that men definitely may have emotional issues, and they may either use substances as a means of coping, or ultimately when it's very severe, they may actually kill themselves. So yes, there's a definite need for men to actually seek counseling and seek counseling early. And we're trying to develop a culture where that is even practiced among men, where men can share how they are feeling with each other without feeling less of a man. And where that is concerned, what we actually have in the Ministry of Health now is what we call the mental health helpline, where persons who may have, including men, of course, who may have issues that are concerned about themselves, where they feel that they are not handling situations well and they're feeling down and out or anxious, they can actually call to get an initial assessment. And based on initial assessment, then they can know where they are and what further steps need to be taken. So yes, short answer, yes, men do need counseling, but we also have to try so we can change our culture with those of us who are aware, and so we can really be open to sharing each other, so that by sharing each other we feel more comfortable. And that's why now the mental health campaign is really speak up, speak now, and also listen up. Because we try to encourage persons to break the silence, because we think that a lot of persons in our country are actually suffering silently and not seeking help early. And in places like United States, I know it's regular for a person to have their own therapist. So we have a good culture for us to actually develop in Jamaica, because it also helps for us to just know where we are emotionally and to make sure that we can stem things from early. And as it relates to use of substances, it's also a cultural thing where it is taught by using these substances that help in working. I mean, even to grave digging, you have to have alcohol there and smoking. So it's really a habit that we have to try and see how we can help persons realize that if you eat well and exercise regularly, get adequate sleep, then you have to work as hard. So it will take a really lifestyle change, which we have to really look on how can we help persons to realize that there's an alternative way to be able to work without using these substances. And it is sometimes very difficult because some of these habits have been seen, modeled by what youngsters see older ones doing, and when they start doing it, they find it harder to break the habit. So it's something that we have to really try to consciously address by helping person realize there's alternative to being able to work hard apart from using substances.
All right, so I've been hearing a lot. I've been looking at the comments and the queries from YouTube. One of the things that was asked earlier was, when are we going to have a part 2? Because I guess somehow they sense that we're at the end of another good program. So I first want to thank God for having allowed this opportunity to come about. And I want to thank each and every one of the panelists for a very insightful discussion. I know I benefited a lot from it. But then in closing, I want you to just give me some closing remarks in terms of how can we become, how much closer can we get to being the complete man, after which I'll just wrap up and then we turn over to the persons for Vespa.
Well, my quick contribution is that I think, especially as men, we need to be much more sensitive to what others are going through. So we can take the example by trying, when we ask person how they are doing and so on, to really being shown that concern and not being judgmental and being able to even share what we are going through. Because by sharing what we are going through, sometimes it helps persons to be more willing to share what they are going through. So as men, we have to try to culture that sense of willingness to show that we are hurting and that we can share what we're going through, so more and more we can develop a culture of caring amongst men. I think men find it easier to share among men than to share among ladies. So I think among the men folk, we need to try and show we can create that habit, a new habit of sharing and trying to help others to find new ways of coping rather than using substances. Over.
From my point of view, the ability to know oneself, to assess yourself as a man, to recognize who you are, where you are, and then consciously to seek to know where you would want to be, will be the kind of framework which will allow someone to become a complete man. I heard an old preacher say once that whenever you remember yourself truly, you remember God. And that might well be true. So to be conscious of yourself and to be able to without frills recognize who you are and where you are will be a starting point in allowing one to seek to become complete. Thank
you. Well, just to remember, I think that the complete man is really not an end product. I think we all are on a journey to achieve this completeness. And remembering that our journey starts in childhood and goes through the various phases of our life. I think the most important thing is to create an atmosphere, a culture, an environment which nurtures and which allows for the males and men in our society to grow and achieve their inherent potential.
And I guess my comment would be on just the physical side, the physiological side, that staying healthy or being complete from a health point of view doesn't require a lot, neither significant investment of money or necessarily significant investment of time. It is really doing a little bit every day with all the things we do, with what we eat, with our activities, and at regular intervals, trying to see a practitioner. Just a little bit every day, and it will all add up to being complete.
Dr. French, any closing comments, remarks?
Did make some remarks.
Whether we are from a single parent family, or the family with mother and father, we all deserve to have the best chance we can in life. So if one finds themselves as a single parent, the single parent should seek help in terms of finding some other figure or some other organization or entity to help to fill the gap where a gap exists. But certainly human beings are amenable to change, and therefore with a proper assessment and with education, human beings can change, and with God all things are possible.
All right. So on that note, I just want to take this opportunity to first again thank God for having allowed this to happen. And then I want to thank the members of the panel for having given your expertise. Well, we're looking at what, over 150 years worth of experience and expertise here. So I want to thank you, each and every one of you, for having availed yourselves to be able to make this program a success. And then I want to thank the leadership of the Andrews Memorial District of Churches. This is actually a district effort, so I want to thank them. And then specifically the communication team for allowing this to happen this way, so seamlessly. So we want to thank those persons. And then naturally the members of the men's ministry and the AY team, and then the audience for having stayed with us until the end, and the questions that you have posed to us and the encouragement that you have given. So we just want to ask that you continue to stay tuned here on our YouTube channel, where you will see more information as to whether or not a part 2 will be coming and how we'll go about getting that done. So continue to follow us, continue to like, comment, subscribe, and share, so that we can actually know what your needs are, so that we can actually try and put forward information and programs to meet those needs. So now we'll go to prayer. I'll ask Elder Nugent to do that, and then we'll close off right here. Thank you very much.
Thank you very much, everyone, for participating. And again, it is indeed a pleasure to have had all of our guests contributing to this evening's program. Shall we just bow our heads for prayer? Almighty Father, we thank you, Lord, for your divine guidance and your blessings upon us. In spite of our sinfulness, O Lord, you have found a way to nurture, to find individuals to nurture and to cradle us, that we can be the individuals that we are. We pause to reflect on those, O Lord, who, because of some deficiency in their family structure, might not have the full support system and network that they would need to be the complete man. But Father, we pray that even as we sat and we listened, that each of us who have had the opportunity to sit at your feet and to be blessed by others will indeed use our opportunity and our blessing to be a shoulder on which others can climb and stand. May we, O Father, be unselfish in all that we do, and may we give an helping hand where we can, mentor a child. May we guide someone in the right path, and may we all be better men and women, having been introduced to you as the source of all that is good. Continue to watch, guide, and protect us now, we pray. In your Son's precious name, amen. God bless you all. Have a wonderful